Well, last fall, millions of Americans made choices about their Medicare coverage, but being proactive about your coverage and care doesn't end after enrollment. Todd Carlson from United Healthcare, Medicare and Retirement Idaho joined us to share the many ways that you can and should get more from your Medicare benefits.
Well, when trying to get or stay healthy, how can people proactively take advantage of their Medicare plan benefits? It's a big question.
Yeah, absolutely. You know, the first thing I would suggest really is to be proactive with your preventive services. So your annual wellness exams.
So don't wait till it's too late, right?
Correct.
Okay,
yeah,
got it.
Get in there, find out any issues you might have. Much better to catch it early than later, and much more costly.
So be prepared. That's planning, be prepared is a big one. How have health plans made it more convenient for people to get access to the care they need?
So, you know, they've really evolved over the last few years. So you've got things like house calls. So now depending on the type of Medicare plan you're on, you can have doctors, physicians, nurses actually come to your home and treat you at home. And then of course, telehealth now is a huge, and video health is a huge tool we use now, which really became popular as the pandemic came and, you know, pushed everything virtual.
And that's got to be really nice. I know that you bring up telehealth and those, but it's kind of that hybrid to where you're like, okay, someone doesn't need to necessarily come in, but I can't just do it over the phone and hear a voice. I certainly don't want to do text, but I want to see someone on my phone, like a FaceTime, to be able to check that out.
Sure, and we see it really a lot with specialists or specialty doctors where, you know, you may have an appointment with a cardiologist where they've already got your file, they've seen you before, they just need to check in with you, and those virtual visits really work well for them.
But then at home is great too, because sometimes, you know, packing everything up and getting in the car, so in home has got to be great, because I feel people are very comfortable in their home, which is good.
Correct.
So how many people are eligible for Medicare, are retired or living on a fixed income? So every dollar counts. So what tips do you have? Every dollar counts. We know that. What tips do you have to help them manage their health care costs? Because that is a big concern for a lot of people.
Yeah, absolutely. So really, you know, Medicare costs can vary by the type of plan you're on and even your health. So, you know, how you use your insurance, how often you see doctors, what procedures you have done. If you have original Medicare, that's really designed, Medicare Part B is designed to pay 80% of your care outside the hospital, and then you're responsible for 20%. So, and that's without any cap or limit. So that can be a big issue. If you have a Medicare Advantage plan, you know, you get predictable copays, predictable out-of-pocket expenses, and much easier to manage your health care.
So looking at your budget, realizing that 80-20 split, I remember as a kid, like when I first got insurance, and I remember, you know, going through that. So that's important. So, and kind of goes back to your first point of being prepared for that.
Correct.
All right, looking at anything that might surprise people when it comes to new benefits or features in their plans to take advantage of.
Yeah, so a lot of plans now, if you're on a Medicare Advantage plan, they come with what we call over-the-counter allowances, where you've got so much money per month to spend on over-the-counter either medications, or even some plans you have the ability to buy healthy foods at the grocery store. So you've got money loaded on your card every month that you can go out and spend on healthy foods. With United Healthcare, we actually have what we call a U card, so our membership card is called a U card, and on specific plans you have that benefit, but also you use the same card for your primary care doctor visit, all your doctor visits, your dental visits, your hearing and vision, all of that is loaded onto one card. So much easier to use versus having the stack of cards.
Yeah, do you know how many times, okay, I've got my wallet, okay, this card's for this card's for that. Correct. So that's really, really convenient for so many.
Absolutely.
What are some additional resources that people should be aware of if they're looking to stay healthy and save their money with Medicare plans?
Yeah, so if you're on a Medicare Advantage plan, you have a phone number on the back of the card that you can call and talk to the plan direct. I always suggest that you have an agent, so some sort of a Medicare or a healthcare agent. Go direct to them. They can answer lots of questions for you. And then with United Healthcare, you've actually got a UHC Medicare Health Plan.com is the address if you want to learn more about United Healthcare.
Well, just all wonderful, amazing information. Thank you so much for the time.
Thank you.
Absolutely. We'll have more Idaho Today coming up after the break.